Do you have a child that has either been diagnosed with or suspected of having ADHD? I'm Dr. Roy Picard, and my office is in Shelby Township, Michigan. I'm a licensed doctor of chiropractic, but what I utilize in my office is chiropractic neurology, functional endocrinology, nutrition, and brain-based therapies. I became board eligible in chiropractic neurology back in 2006, and in 2008 I became a certified DAN doctor. DAN refers to Defeat Autism Now, and that was through the Autism Research Institute. My specialized postgraduate training, along with my 22 years in practice, is what allows me to effectively work with these children to allow them to reach their optimum level of physical, mental, social, behavioral, emotional, and academic performance. When I speak with the parents of the children who are affected, the parents usually express to me some very valid concerns. What options are available for my child other than medications? What are the long-term effects of medications on my child? What happens when the medications don't work? What is the likelihood that my child will progress to alcohol and drugs when they get older? Will my child ever be able to function without the medications? Will my child's risk-taking eventually catch up to him or her in the form of a serious injury? When will my child grow up and behave appropriately for their age? How will my child function later on in life without the ability to remain organized or the ability to, let's say, keep it together? My child's behavior is disrupting the whole family, and it's not fair to the others. Will it ever change? Now, I've also had children express to me their concerns. They want to know, will I ever be able to relax, feel calm, and be able to focus? Will my grades ever get better? Will I be able to play organized sports? Will I ever get through the day without being yelled at by either my teacher or my parents for my behavior? I can tell you that when I hear this, it's absolutely heartbreaking. And unless someone has a child who is suffering with this, they just don't understand the hardship that is placed on a child as well as the entire family. To hear some of the stories from the parents and even some of the children is absolutely heartbreaking. And all I can tell you is that it's really important for both the parents as well as the child to understand that it's not necessarily that the child chooses these different behaviors or emotional outbursts or lack of focus and subpar academic performances. Don't get me wrong, we don't want to use as a label or diagnosis as an excuse, but once you truly understand what is going on, then things will make more sense and less blame and finger pointing will be going on. Now, what I want you to understand is this. No matter whether your child has been diagnosed or suspected of having ADHD, having a thorough understanding of your child's body chemistry and their level of brain function is the key to getting the necessary help for them. Now, I work to uncover the core issues as to what has led your child to their diagnosis or suspected diagnosis. Children with ADHD or those suspected of having ADHD, well, they all show an imbalance in their brain known as a functional disconnection syndrome. And it doesn't mean that there is anything broken with their brain or that surgery is required. With the proper evaluation, it can be determined if one or more areas or lobes of the brain are not working in sync with the rest of the brain. When this occurs, it will lead to a lack of focus and lack of ability to pay attention. Other areas of the brain, when not in sync with the rest of the brain, are more involved with hyperactivity and impulsiveness. With proper care, which involves utilizing specific activities and brain-based therapies, these out-of-sync areas of the brain can then be stimulated or exercised to become in sync with the rest of the brain, restoring a greater ability for the child to either remain focused, pay better attention, not act out impulsively, remain calm, and any of the other symptoms associated with ADHD. Now, keep in mind that when we are looking at brain function, it is extremely important to make sure that the brain has the proper fuel being delivered to it. Without proper fuel, the brain is going to fatigue, and this will lead to an increase in the symptoms that your child is suffering with. The good news is that testing is available to analyze body chemistry, with the intent of making sure that the brain is getting the proper fuel. This part of the care, referred to as metabolic care, is achieved by specific questions and specific types of lab work. Understanding what nutritional deficiencies exist in the body will allow you to change your child's diet to allow specific areas of the brain to function at their optimal level, allowing your child to then express their true potential physically, mentally, socially, academically, and behaviorally. So what is your next step? Well, what I do is I recommend that you call my office and schedule a free consultation. During the consultation, I want you to tell me specifically what is going on with your child, what your child is going through, what you have tried to do to help, what has worked, and what hasn't worked. I want to hear what your expectations are so that I know if they're realistic. I'm going to give you a greater understanding of what I do, how I can help your child, the types of testing that has proven to be beneficial, the different care that has proven to help children like yours, as well as your responsibilities regarding home therapies, diet, and other lifestyle changes. Now, I'll try to answer all of your questions for you so that you can decide if this type of care is what you feel is best for your child. So again, if you would like to meet with me for a free consultation, this would be a good place for us to begin. I wish you, your family, and of course your child, nothing but the very best.